All right. Hello, everyone. My name is Yinshuo. I'm an AI researcher at Tulane University School of Medicine. Today, on behalf of Dr. Nasir Marouche, I am presenting how AI is changing the AFIB management in the EP world. We believe there are two critical gaps in AFIB management today. One is early detection. The other one is treatment outcomes. Detection gaps are very common in both undiagnosed and recurrent patients. As we can see, if we compare different monitoring strategies, compared to ICM, even the repetitive 7-day ambulatory ECGs at 3, 6, and 12 months can only detect less than 80% of the AFib patients. And on the other side, the treatment outcomes are also not satisfactory. So even with the introduction of PFA, there are still around 30 to 50% of the recurrence after the ablation. And this is how AI has been introduced in AFib management. It is not a concept anymore. In today's world, it has been introduced into the most recent US guidelines for the diagnosis and management of AF to better tailor therapy to individual patients. So what AI is solving? We believe in terms of detection, it can improve the diagnosis of AF and also help us to better conduct the management and monitoring for the patients after the ablation. In terms of the outcome, it improves the delivery of treatment and it can help us to better conduct the stroke prevention. And this is the first topic we want to talk about, diagnosis of AFib. This work has been done by Dr. Han Feng from Tulane University, and we call it RECLASS AF. The RECLASS AF score gave us a continuous score from 0 to 100 instead of the traditional score system like paroxysmal to persistent. It gives us a more granularity of how we evaluate the severity of one AFib patient. And this is how we use it. Across the patient journey, we can apply it into different clinical visits, no matter before or after treatment. And by monitoring the changes of each times of the AFib score, we can conduct further modification of the medicine or the lifestyles to help the patients to achieve a better outcome. The second thing we want to talk about here is about the post-treatment monitoring. And this comes from one challenge that we faced in the clinic, is that conventional at-home monitor may miss the detection of recurrence. For example, as this shown as example, we believe that if you only monitor one, like for example, one single lead ECG on the sinus day, you may miss the detection of the AFib episode, and it really lower the accuracy for the identifying the recurrence status and also the actual time of when the first atrial fibrillation event happened after the ablation. That is why we provide these solutions to changing these snapshots into a 7-day monitoring window. We built a deep learning model that reclassified the sinus rhythm into severe sinus and benign sinus. Severe sinus means that if there's one atrial fibrillation event that happened either 3 days before or 3 days after any times you measured the ECGs. And this is a way for us to use this whole 7-day monitoring window to give us a better understanding about patients' recurrent status, and we call it Tulane Digital Monitor Day. Then how about the outcome of the treatment? Here we want to present our work called SOFA, Simulating and Optimizing Atrial Fibrillation Ablation, that we published on MICAI 2025. The whole idea of this is to use any pre-ablation images with our deep learning model to mimic or to predict how the post-ablation image will look like, especially the fibrosis and scar formation. And with this, we can better predict the recurrence of the recurrent status of the patients. And actually, since we have the data set from DCAF2, which is one of the largest clinical trials that compared MRI-based ablation, we have the actual post-ablation image. And with those actual images, we can do the reverse engineer to identify the best parameters from the pre-ablation images to better guide the ablation for next time in terms of the temperature, pressure, and electricity. Finally, is the stroke prevention. So here we have turbos, Tulane University risk of bleeding a stroke. The whole system is based on 4 types of variables: demographics, vitals and lifestyles, comorbidities, and medications. With all this clinical profile of patients, we can actually have a better understanding about patients' risk of bleeding or stroke, combine them together to better tailor our strategies of the oral anticoagulations. And here is how we use it today. For all these 3 patients, they all share the same CHA2DS2-VASc score and HAS-BLAST score of 2. But our Tulane turbo score can actually tell us whether this patient is at high risk of stroke, bleeding, or both. So after knowing all of the problems that AI has been solving for the atrial fibrillation management today, we want to know how AI should be used and how we need to combine them into the current clinical workflow. And we believe there are 2 important factors. The first one is the standardized platform. And the second one is that we need a large-scale external perspective validation for all the AI algorithms that we have been developed from the single centers, so that we can have a external generalizability. And first, let's talk about the platform. In today's Tulane digital clinic, we have this platform that bridge all the AI algorithms into different types of data, from EHR, surveys, and even the wearable devices. By leveraging this, it's actually building this platform and in between the physicians and patients, so that they can know how to leverage this to generate the result, and they may need to look at and to connect better. This is one use case example. One patient can just upload the ECG PDF generated directly from the Apple Watch and to our platform to do the sinus rhythm reclassification, as we just mentioned. And then the platform will notify the physician that if there is a severe sinus happened, and physician will make the judgment about whether the patient needs a follow-up clinical visit and how to do the better monitoring based on his status. So how about the prospective study? And here we are very proud to share our collaboration with Samsung for the Heartbeat study. This is one of the largest scale digital health study on the sick population. Samsung is providing us over 10,000 Samsung Galaxy Watch for our patients, and right now we have been recruiting over 2,000. We follow up each of them for the whole year, and we collect all different types of digital health data, ranging from PPGs, which is photoplethysmography strips. It's like an optical sensor that it measures the blood flow, and also the ECGs. We have right now over 200,000 ECG, single 30-second ECGs collected from 2,000 patients. And not to mention about the night sleep cycles and different types of biometric data. Here is another look of the watch. For this watch, we can collect all different biometrics, including the blood pressure and the ECG PPGs we just mentioned, and all the sleep quality information, and combine them together to identify this we call AI biometric fingerprinting. And this is really important because the data is not fragmented anymore. It is giving us the most important most important tool to identify the underlying correlations and better develop the fusion model in the future. And here is some examples of our work so far. So the AF detection from the wearable watches is not a secret or a problem anymore. Every watch can do it. But is one model applied developed for this device can be applied to another one? This is very important. So that is why here we used our over 200,000 labeled ECGs from our DCAF2 trial. And this device is called ECG Check. It's also a handheld device. It's a portable device and that people can measure the single lead ECGs. And we developed this model with AUC over 0.99. And then we applied to our 12,000 ECGs from heartbeat by the time we conduct the study. And we generated AF validation accuracy over 97%. And you may ask, how about PPGs? PPGs is one of the most important projects that we have been conducting with Samsung. And here is one example shows the passive AF detection with PPGs. So with the ground truth label they generated from the synchronized ECGs, we developed this model for only using the PPGs for AFib detection. And this one can be run in a large scale, and also it can run continuously and passively. It significantly reduced the patient burden by just submitting ECGs every day. And on the right side, we have a synchronized ECG and PPG examples to show you how the AFib PPG look like compared to ECGs. And this morphology delineation is the next step we want to conduct. And here is another prototype we want to share with you that we submitted with Samsung. We call it Turing AI PPG-based lab biometrics fingerprinting. With our own deep learning models, we can just classify those lab biomarkers through the binary classification, and we can show that our own self-developed models perform much better than most of the public available or the foundation models. And this is our next step to actually build this biometric fingerprinting with the clinic on the wrist. So the last part of today's presentation, I want to tell you how a patient's journey will look like with Turing Digital Clinic today. For example, a 64-year-old man presents with Turing Digital Clinic with certain symptoms: palpitations, shortness of breath, and exercise intolerance. The patient is first given a wearable smartwatches for continuous monitoring and AFib detection. With our PPG model, the AFib is detected. So that is why he come to the clinic again and gave us all the EHR data to calculate the reclass AF, the severity score. And we found that the patient is at a high risk of progression and may warrant the ablation. But before the ablation, we may want to evaluate its risk of stroke and bleeding. That is why we utilize our turbo score to guide the ablation and anticoagulation strategy. With knowing that the patient has a high risk of stroke and low risk of bleeding, the patient is set to receive the PVI and oral anticoagulations. So during the treatment, we will use the patient's information to generate the best parameters and based on its pre-ablation images, and to give him the optimal recurrence outcome possible. And after the treatment, we ask him to use our Samsung watch again to wear it every day to submit one strip at least for a week for the sinus reclassification to monitor his recurrent status and whether there's any issue that happened may warrant the physician's notice. And after we found that patient is free of recurrence, We still ask him to do a long-term follow-up with the wearables and the digital clinic. So that he can, if there's anything happened, we can know right away and help to manage his status and conditions. So this is today's AI in AFIB management. And I would like to thank you everyone for your attention, and thank you Dr. Nasir Marouche and the whole team for giving me this opportunity to present. Thank you.